Dr. Donish.
Hi, I'm Dr. Donish Maslamdoust. I'm an interventional pain physician from Lexington, Kentucky. I want to thank Emily for organizing this. I really have a lot of admiration for you. As someone who has taken such a tragedy in a mother's life and turned it in such a positive direction, I think that takes a lot of courage and a lot of strength. I can tell you many stories about patients who have been damaged or affected by opioids. I'm going to tell you one story about a patient I'm going to call Martha. Martha is a grandmother living in southeast Kentucky, desperately trying to keep her family safe and together. She has 2 children, a son and a daughter. Now in her late 60s, Martha was a homemaker early in life. She was married to a coal miner, who she lost too early if you ask her. When her husband died, Martha went to work at a grocery store to provide for her 2 children. They all grew up in a struggling but loving home. When her son was in high school, he had grown up in the shadow of his father and become a local football star. Well, one Friday night, he was dealt an exceptionally hard tackle and he injured his back. He was unfortunate enough to be treated at a time when opioids were promoted as completely safe remedy for pain, as long as it's, quote, taken for pain and nothing else. In the infancy of opioid prescribing, it was common knowledge that if a patient asked for more medications, it's simply because the doctor was under-treating his pain. And of course, any level of pain is a dark slight on a physician's reputation for being a caring provider. So dose after dose increase was made, but alongside it, ever increasing pain. This former football star barely graduated high school. He spent most of his days at home, focusing on nothing else but the pain, and creating a self-fulfilling promise of incapacitation. He no longer had a sense of purpose or even a desire to pursue one. Eventually, his needs outstripped what his doctors were comfortable providing, and he began to deal to support a growing habit. Tired and frustrated, Martha eventually kicked him out to protect her younger daughter. But Martha's son continued to keep in touch with his little sister, and to aid in his bond with her, he eventually gave her a pill to try because she had recurring headaches. Now mind you, this is a girl who had never even taken a Tylenol, but was now taking a DEA level 2 controlled substance because that's how prevalent these were in that community. It was normal for use for just a simple headache. She was immediately hooked and spiraled out of control even faster than her brother. She had 2 children fathered by men she had traded favors for drugs. These 2 children were later abandoned with Martha to raise. And in spite of her aching joints, she continued to work to feed her grandchildren, take them to and from school, and give them every chance of a loving home that she could provide. Martha herself had been started on opioids for arthritis years ago, and while she was raising the grandchildren, her children routinely poached her medications under the constant threat of pursuing custody of the children. Eventually, her daughter did regain custody of the children, but many fights ensued to try to keep her daughter safe and the grandchildren from harm's way. In every fight, Martha had to give ground and more medication in order to bribe protection for the grandchildren. When she finally refused to give any more medication, Martha's daughter moved away with the grandchildren, and Martha passed within a year. Officially, it was a heart attack, but I think it was a broken heart. So many lives have been damaged by the scourge of opioids. Clearly, this story does not represent the mainstream of chronic pain patients, but a lesser version of this plight is very common. These lesser versions involve patients who were once started on opioids and saw a rapid rebound in life, but years later felt less functional and more dependent on taking medications for any semblance of relief. This, in fact, was the same scenario as Martha herself. Anyone involved in her care would say, well, we have no other option. But at one point, we did have that option. her care was prematurely taken down a path of no return. Martha herself could have been given a greater vitality, longevity, and quality of life if her pain was treated different earlier. This is true for many, many patients improperly initiated and maintained on opioids to the point of physical dependency, which is different than addiction. This is a very difficult concept to explain to a patient who has found nothing but relief from opioids. Overall, opioids have an elusive effect that's difficult to see from the perspective of a patient taking it. When first started, there's no question that many people feel better, but as time carries on, it's hard to compare the diminishing benefits from the increasing harms. Most patients become blind to the rebound pain. This is an increased level of sensitivity and pain that happens when the drug level drops below a certain level. When this happens, patients just medicate again and feel the surge of relief and get the impression that only the medication provides this relief, when in fact, a large part of their pain experience is actually caused by this rebound effect from their opioids. Our body is always adjusting to a baseline, and if opioids are part of this fluctuation, the baseline is on a steady incline. After a while, the brain, nerves, muscle, and just the entire physiology of the body can no longer carry on normal function without the presence of an opioid. For millions of Americans, there is a violent denial of this reality. They ask, if not opioids, then what? And it's terrifying for them. It's akin to asking, if not oxygen, then what? But to answer this question, we also need to answer why opioids were thought to be a good idea to begin with. Let's rewind the lives of Martha and her children. A teenager with a football injury is similar to someone in their mid-20s in a car accident, or a mid-30s coal miner who has an injury. Any one of these people can be struck with an injury that has the potential of evolving into chronic pain. But if treated appropriately, they have a high chance of recovery. There are medical techniques and innovations that can actually help the body repair if the proper cause of the pain is identified. When all we do is throw an opioid at the problem and never stop to understand or care for the injury that causes it, then how can we ever expect someone to get better? There are things that we as physicians, physical therapists, psychiatrists, and many other healthcare providers can do to help people avoid surgery and fix the problems that are causing pain. But we have to be knowledgeable about how to safely provide relief in the short run while also fixing the problem in the long run. The body is a self-healing machine, and our job as specialists in pain ought to be understanding why it's not healing and how we can help the body regenerate. If we never exposed a young football player to opioids, he would never have become addicted, he would never have shared his medications with his younger sister, and his entire family would have had a slight chance at a happier life. The tides are changing, and I am seeing better understanding of not only pain, but also the value of getting well-versed specialists involved early. Treating an injury or a painful condition before it becomes chronic pain is key. But we also need to emphasize that some pain is a normal part of life. That as a collective society, we need to realign our expectations around pain. That we cannot eliminate pain at every moment, but we can effectively control it and work out of it. It's time we stop brushing pain under the opioid carpet, because clearly it's not doing a good job of hiding anything. Let's stop treating pain as this last resort failure of life that's only tempered with a drug that creates so much desperation and devastation. Let's start treating pain as a treatable condition that has a lot of hope for recovery. Thank you.